So it's probably one of the absolute most pressing questions people have when they start looking into cosmetic gynecology. Does a labial puff procedure actually affect sexual sensation? Well, welcome to this explainer. Today, we are just going to cut right through the noise, okay? We're looking straight at the clinical realities of a procedure that's becoming way more common than you might think.
We'll be exploring the labial puff today, specifically through a medical and functional lens. We'll quickly cover the anatomy, the clinical options, and, of course, get you a direct answer to that big question about sensation, all grounded in expert medical sources.
All right, but before we talk about the procedure itself, we kind of have to understand the anatomy. We're talking about the labia majora here, the larger outer lips of the vulva. And unlike the delicate inner labia minora, these guys consist of much thicker skin and fatty tissue. The absolutely crucial takeaway here is their actual function. They basically act as the outermost protective barrier. Think of them as a natural cushion for the female genitalia.
So, you might be wondering, why do these outer tissues lose their plumpness over time in the first place? Well, our medical sources highlight a whole mix of biological and lifestyle factors. Natural aging and, the whole reduction in collagen, that plays a massive role. Then there's menopause, where hormonal shifts literally decrease both the size and the volume of the tissue. Add in things like the trauma of vaginal childbirth or even extreme weight loss, and the end result is basically a deflation of that supportive cushion.
And honestly, that loss of volume is exactly why this whole conversation isn't just about aesthetics. It's really not. A deflated labia majora completely loses that vital cushioning effect. And when that happens, the much more sensitive inner tissues are left totally exposed. Because of this, patients frequently report some very real-world functional symptoms. We're talking severe discomfort during physical activities like, say, cycling, chafing against tight clothing, recurrent urinary tract infections, and dyspareunia, which is the medical term for pain during sexual intercourse.
So how exactly is this clinically addressed? Well, the labial puff is the common everyday term for restoring this lost volume. And medically speaking, there are two primary clinical approaches to actually achieve it. You've got hyaluronic acid, or HA fillers, and then you have autologous fat transfer. Let's quickly break down exactly how these two options stack up against each other.
Okay, so if a patient opts for the hyaluronic acid fillers, they're basically choosing a biocompatible gel. It's a non-surgical option with immediate results, which is great, but the catch is, it's temporary. It'll usually last anywhere from 6 to 18 months, totally depending on a person's metabolism. On the flip side, we have autologous fat transfer. Now, this is a minimally invasive surgery that actually uses the patient's very own harvested fat. It definitely requires some real recovery time, but the major draw here is that the volume retention, it's permanent.
Now, just focusing on the filler method for a second, the clinical guidelines for this require immense precision. It's a highly targeted 15 to 30-minute outpatient procedure, and it's typically just performed under local anesthesia. It is incredibly fast, right? Almost zero downtime. But, and this is a big but, it really demands an expert hand to make sure the proportions are correct and to avoid any nasty complications.
But what if a patient is looking for a permanent solution? Well, that brings us right back to the surgical fat transfer process. It's essentially a three-step journey. First up, a small amount of fat is harvested via liposuction, usually pulled from the inner thighs or the abdomen. Second, that harvested fat goes through a really strict purification process. They do this to isolate only the best, high-quality, viable cells. And then finally, step 3, those purified cells are carefully injected and actually sculpted into the labia majora using these specialized tiny microcannulas.
Now, the absolute crucial number to remember here is 60 to 70%. That right there is the expected permanent retention rate of the transferred fat. Because, the body naturally just reabsorbs about 20 to 30% of it on its own. Because of this, highly experienced surgeons will actually deliberately overcorrect just a little bit during the initial procedure. So the tissue might look a bit overly full right out of surgery, sure, but once the swelling settles down, it leaves a very natural, long-lasting volume.
Okay, so bringing this back to the primary focus of our explainer today, we know how the puff works now, right? But how does all this extra volume actually impact sexual sensation? It is, without a doubt, the #1 concern for women looking into these procedures, and honestly for very good reason.
And here is the direct clinical answer, straight from our medical sources. Once the area is fully healed, the sensitivity of the genitals will go back to normal. That's right, a properly performed labial puff procedure, whether you're going the filler route or the fat transfer route, is generally considered completely safe for sexual function. It does not inherently cause any long-term loss of feeling. No way. Now, you might experience some temporary numbness right after the procedure, mostly just due to local anesthetics or, normal swelling, but that completely resolves as you heal.
Actually, what's really fascinating here is the nuanced cause and effect of it all. See, while the puff isn't literally rewiring your nerves to increase your baseline pleasure, it does offer a massive, massive functional benefit. By restoring that protective cushion we talked about earlier, you're drastically reducing the friction and chafing that causes pain during sex in the first place. Plus, our sources note that hyaluronic acid fillers can actually help hydrate the mucosa, so you're indirectly improving vaginal lubrication and just overall sexual comfort. Talk about a win-win.
And to really understand why sensation is so well protected, we just have to look back at the anatomy. The clitoral nerves, which are the primary drivers of sexual sensation, are deeply protected sensory pathways. A skilled cosmetic gynecologist is working superficially, literally just within the fatty tissue of the labia majora. Because these injection zones remain entirely separate from those deep clitoral nerve pathways, a properly executed puff procedure just won't desensitize the area.
Of course, getting to that final, beautifully healed state, yeah, that requires a bit of patience. For the surgical fat transfer option, days 1 to 7 are going to involve mild swelling, some bruising, and basically you just need to rest. Moving through weeks 1 and 2, patients absolutely must avoid strenuous exercise or activities like cycling. Finally, by around weeks 4 to 6, the area is typically fully healed and it's totally safe to resume sexual intercourse. The filler option, meanwhile, has practically zero downtime, but you still gotta abstain from sex for about a week just to let that gel settle appropriately.
Now, just to be perfectly clear here, while this is generally very safe, it is still a medical procedure with real clinical realities. Potential risks do include temporary numbness or swelling, which again is very common. More serious, though, definitely rare risks include things like wound infection, asymmetry where the volume ends up looking a bit uneven, or partial fat reabsorption that might require a little touch-up down the road. This is exactly why these procedures should literally only ever be performed by highly qualified specialists.
Which really leaves us with one final, kind of provocative thought to consider. Given the profound relief from pain, chafing, and sexual discomfort that so many patients report, is the labial puff simply a cosmetic luxury, or should we really be looking at it as a functional necessity for women's health? Honestly, the medical data certainly blurs the line, doesn't it? Well, thank you so much for joining me on this explainer. I really hope it gave you the exact clarity you were looking for, and I'll see you in the next one.